This is the third in a series of talks on health externalities and corruption of science. My name is David Eagleman. I'm a clinical professor in the Department of Family Medicine at Brown University. First, some conflicts. First, for conflicts for Brown. The Warren Alpert School is named after Warren Alpert. Warren Alpert ran Extramarts. Extramarts made much of their profits selling cigarettes and beer and wine. A little bit ironic for the namesake of a medical school. I testify and work as an expert witness at the request of injured plaintiffs in talc powder, asbestos, diacetyl, that's butter flavoring, and popcorn, Vioxx, metal-on-metal hip implants, opioid litigation, and a few other toxic substances. Lawyers had no input into this presentation or any of the others. Brown University does not fund or authorize or approve this research. Brown does not stand behind this research or want to get anywhere near it because many of its funders are subjects of its research. First, this is on talc and asbestos and how this health problem occurred. A little bit of a refrain. Asbestos is a poison, which is the form of the poison is as a fibrous rock. It has no onion properties. That is, it is a latent disease. If we were in a snowstorm of asbestos, you couldn't smell it, you couldn't feel it, you couldn't taste it, it wouldn't hurt your nose or throat. It wouldn't cause you to get short of breath for months or even years after you were at high levels of exposure. In most situations, asbestos is invisible. You can't see it. Thus, it's a very insidious cause of disease, and the disease occurs after 10 to as much as 60 years after first exposure occurs. There are 6 kinds of asbestos. Asbestos is a commercial product, not a geologic term. Chrysotile, amosite, crucidolite, and anthophyllite were sold as a product. 95% of the asbestos was chrysotile, that's this fibrous band. 3 to 5% was amosite, 1 to 2% was crucidolite, this is in the United States, and less than 1% was anthophyllite. Tremolite is an accessory mineral in chrysotile. That means it's present in rock that has chrysotile naturally. It's also present in talc mines associated with the talc similarly. Actinolite has never been sold as a product, but it is associated with talc and is found in talc products and talc mines. The chemical formula of these asbestos minerals are quite similar. They all have a silicon oxide core, as does talc. Asbestos is a term for a product that contains fibers that are long and thin, 3 to 5 times longer than they are wide, and generally, by legal definition, longer than 5 microns in length. But what's in the bag is not all fibers. In fact, it's sometimes less than 50% of the material in the bag is a fiber. It's mined in open pit mines and underground mines. It can form as a fiber or it can break off, but the final product of either can be long and fibrous. So you can see there's not any visible difference between a fiber caused from cleaving off a larger rock to that actually first grows as an asbestos form fiber. And in terms of their measurement and size, Tremolite broken from rocks generally has a lower aspect ratio, but they overlap greatly. They cause a variety of cancers: cancers of the lining of the lung, cancer of the stomach, cancer of the abdomen, cancer of the larynx, and cancer of the male genitalia and female genitalia. The testes, that is the area around the testes, and the ovary. Most ovarian cancers are actually started in the fallopian tubes and not the ovary, but they've been called ovarian cancers because they show up enveloping the ovary. The lung has as much surface area as a tennis court, and so it is the best filter. This is an asbestos fiber taken from the lung for finding asbestos. Talc. Talc also is mined. This is an open pit mine owned by the Johnson & Johnson company until the from about 1966 to 1988. And the processes that cause talc to form also cause asbestos to form. There are transitional fibers, which are fibers that include both asbestos and, in this case, cummingtonite and talc fibers. So talc forms as a plate and also as a fiber. Finding asbestos in talc is like finding chocolate chips in ice cream. They're mixed in, but they're not mixed like chocolate. So it can be hard to find them. This is a picture of talc miners in an underground asbestos mine in Italy. A talc mine in Italy. Talcosis is a scarring in the lungs similar to asbestosis. I'm going to give you a roadmap of where we're going to be going. I just introduced myself. I'm going to talk about how asbestos is found in talc. Talk about J&J's safety policy. What happened about when J&J recognized that asbestos was in its talc. Warnings that should have gone on talc products that didn't. And the importance of talc to Johnson & Johnson. Mrs. Van Clive is a patient who died from inhaling asbestos in talc. Not going to talk much about her, but I wanted to mention the fact that these are real people who get real diseases. 3 principles that J&J recognized early on. First, asbestos is in all talc mines. Second, you can't get the asbestos out of talc once it's mined or even before it's mined. And there's no safe level of asbestos in talc or anywhere else. This is a Johnson & Johnson memo from 1973 where they recognized there was no such thing as clean mines. And by that, they meant asbestos-free mines. We are confident that fiber-forming or fiber-type minerals can be found in the mines. The usefulness of the clean mine approach for asbestos only is over. In other words, they thought they could say that their mines were free of asbestos. By 1973, they recognized there were no mines that were free of asbestos. And there are 4 different rock formations that can form talc. All of them can contain asbestos and do contain asbestos. In 1972, J&J told the Department of Health and Human Services that talc cannot be processed to remove asbestos-formed particles. That was an incorrect belief. We know of no process that guarantees total removal of all elongated particles from talc. The Johnson & Johnson process of benefacting Vermont talc, which we believe the most advanced in the field, will not guarantee a zero tolerance for elongated particles, otherwise known in this case as asbestos. Since there's no safe level of exposure to asbestos, there's no safe level of exposure to talc that contained asbestos, which happens to be all the talc. Johnson & Johnson recognized that there was no safe level of asbestos exposure, no safe level. This is Mr. Hopkins, who represented Johnson & Johnson in court. He spoke as the official representative of the company and recognized that asbestos was a carcinogen, could cause mesothelioma and ovarian cancer. And it was especially true that children were at risk. And that's because children live a long time, and it takes a long time for asbestos to cause cancer. So the longer you live after exposure, the more likely it is you're going to get sick from the exposure. Selikoff told Johnson & Johnson in 1972 the only safe level was zero. And he felt that he told J&J that they had not proven that their powder was safe. These are organizations, including Johnson & Johnson, of course, that believe that there is no safe level of exposure to asbestos. Next stop, asbestos and talc and J&J safety policy. In 1974, Johnson & Johnson's policy was full cooperation with the FDA, and they told the FDA, if the results of any scientific study show any question of safety of talc, Johnson & Johnson will not hesitate to take it off the market. Of course, by this time, unknown to the FDA, but known to J&J, there was more than a question of the safety of talc, since they knew it contained asbestos, and they knew there was no safe level of exposure. Nonetheless, that's what they told the FDA their policy was. Not true. Now we're going to talk about Johnson & Johnson's concerns about talc, FDA involvement, self-regulation. This is the test method that was developed that was inadequate for finding asbestos. A concentration method, a test method that Johnson & Johnson was aware of that they rejected because it was, quote, too sensitive. Test results showing that Johnson & Johnson knew they had asbestos in their talc. Citizens' petitions to the FDA requesting that warnings be placed on talc, which the FDA rejected. And then the company defenses, one of which is to redefine asbestos. Chapter 1, J&J's concerns about asbestos. In 1958, J&J had its asbestos tested by the Patel Laboratories, and they found fibrous particles of talc and amphibole. This was tremolite. Fibrous tremolite is asbestos. So they knew as early as 1958, J&J did, that there was asbestos in their talc. Now, they also knew that there was a long history of talc being found to cause disease in workers. This is a paper in 1943 where it was reported that there was both asbestos in the talc and that the talc exposures has caused scarring in the miners. Again, this is a paper on talc pneumoconiosis, which is dust disease of the lungs. In this case, talcosis. Like asbestosis, talc scarring was named after talc. It was called talcosis. Skeepers in 1955 did another paper on the health effects of talc mining on the human lung. He showed pictures of talc, tremolite asbestos, and anthophyllite asbestos in the lung in one of the cases. J&J, despite all of these findings, bought the Vermont talc mines in 1966. And they noted that baby powder represented the cornerstone of their baby products franchise, and that they, after this time, had a large investment in a talc mine. They were concerned at this time about lawsuits related to exposures to talc. In 1968, Crawley of the HEW did a study and found fibers in 22 cosmetic talcum powders tested. That's all of them. The fibers were 8 to 30% by count, with an average of 19%. They didn't identify whether these fibers were asbestos in this paper, but they did note that miners working with talc had developed cancer from in the lining of the lung, which meant it was contaminated with asbestos, because cancer of the lining of the lung was only caused by asbestos at this time, and cancer of the lung. Another companion study done the same year, they did identify asbestos in the lungs of rats who they had done an experiment with. And this is a tremolite asbestos fiber in the lung of a rat who had been inhaling cosmetic talc. J&J knew about tremolite in their talc, and they were concerned about possible lawsuits in 1969. We've been concerned to a greater extent with regard to possible dangers relative to the inhalation of the talc, they wrote. Since pulmonary diseases, including inflammatory, fibroblastic, and neoplastic, that's cancer, appear to be the increase, it would seem to be prudent to limit any possible content of tremolite in our powder formulations to an absolute minimum. They were concerned that tremolite was going to cause cancer, and that meant that they knew the tremolite was asbestos tremolite and not a rock. And they were concerned in the same memo about being sued for inhalation of talc by consumers. In 1971, the first paper recognizing that there was cancer in the ovaries was published by Henderson. J&J met with Henderson, and they tried to claim that Henderson had found talc and asbestos in the ovaries, although he only published finding talc in the ovaries. He told J&J when they met with him in April 1971 that they had found asbestos and talc in the ovaries. J&J suggested it was from contamination. Henderson said, no, the talc and asbestos was deep in the ovaries. Therefore, there was no question of surface contamination from talc in gloves or talc in the laboratory. J&J had the tissue sent to Langer, who worked at Mount Sinai, who was a geologist. He confirmed Henderson's findings, but he also found chrysotile fibers not just in the uterus that had been sent to him from Henderson's studies, but also in the talc from Johnson's baby powder. He met with J&J and showed them the material under a microscope. Next, the FDA gets involved. Kretschmer, who was the head of the New York EPA, warned the Department of Health of the federal government, this is HEW at the time, about the hazards of cosmetic talc. He wrote them and said in 1971, "It is essential, I believe, not to be misled into demanding conclusive proof that low-level asbestos exposure are a health hazard before acting to eliminate them. The required epidemiologic work is too time-consuming, and the hazards of larger exposures are too well known to delay action." The month before, Kretschmer had met with Langer and been told that Langer had tested various talc products, cosmetic talcs, off the shelf and found asbestos. In response, Kretschmer wrote the US FDA to have them take action. It is essential, I believe, not to be misled. He wrote, "I believe the indicated action for talcum powder is 1. Conduct extensive sampling of all available brands to check our initial findings on asbestos content. Advise the manufacturers of brands containing significant amounts of asbestos to revise their formulations or remove their products from the market." At the time, there were cornstarch substitutes. Cornstarch, of course, doesn't contain asbestos. And then perform a follow-up epidemiologic study to determine what adverse health effects may be resulting from this exposure. In response, he also went public. Jerome Kretschmer was quoted both in the New York Times and in radio shows saying that some brands of talcum powder may be dangerous because of high asbestos content. He repeated that New York's Mount Sinai Hospital had tested 2 unnamed brands. One of them was Johnson & Johnson's, and found between 5 and 25% asbestos. He said that was a risk of development of cancer. In August 1971, the FDA had a meeting of industry people and Langer. Langer told the FDA that he found chrysotile in Johnson & Johnson talc. The FDA then hired Lewin, who was a geologist at another school in New York, to test 100 samples of cosmetic powders. He did so. It's important to understand that Lewin had been a consultant to both Johnson & Johnson and Whitaker, Clark & Daniels. So he was an industry-funded person and was working for industry at the time he conducted this study for the FDA. He sent his final report in August of 71. August of 72. This date's wrong, it's 72. The analysis showed that 59 of the products had no detectable amounts of any of the asbestos-form minerals. That meant, of course, that 41% had asbestos. 20 had small but definitive percentages of tremolite. 7 had small percentages of chrysotile. 9 had both tremolite and chrysotile. And seven had substantial percentages of one of both. These are the products he found asbestos in. These are the J&J products he reported finding asbestos in. Medicated powder, baby powder, 3%, 2%, shower to shower. J&J convinced the FDA to reject Lewin's initial final report on asbestos findings. And the FDA went to Lewin and asked him to retest the talcs. In addition, J&J had their labs retest the talc to convince the FDA not to publish Lewin's findings. And they reported results from 5 different laboratories, claiming that none of them had found asbestos. Unfortunately, some of J&J's retests confirmed Lewin's findings. McCrone tested some of the same Johnson & Johnson product and found tremolite in two samples, 0.5% and 2 to 3%. These were rods, which would be considered a fiber at the time. J&J told McCrone not to use that report. McCrone changed the report, deleting the 0.5%, changing it to a few isolated particles, deleting this entire line, and deleting the level of findings in the conclusion. Of course, when they first received McCrone's results, Johnson & Johnson was not surprised. There are trace quantities of tremolite present, confirmed both by McCrone and Bill Ashton. Levels are extremely low, but occasionally can be detected optically. This is not new. And of course, it wasn't new, since they had found the same thing in 1958. Again, these are some changes from the original report to the final report. So J&J sent the altered report to the FDA to convince them to change Lewin's results. Gordon and Colorado School of Mines and Pooley used a less sensitive method and didn't find asbestos. We'll get into that later on. But if you don't use a sensitive method, since the concentration of asbestos is low, you'll come up with a false negative result. So in 1972, J&J pressured the FDA to discount the Lewin results. This is the summary that J&J wrote at the meeting. I pointed out that having listened to Dr. Lewin and to the world authorities we had assembled as consultants, I was convinced that there wasn't a shred of evidence to support the idea that either our Johnson baby powder or shower to shower contained any chrysotile asbestos. I concluded that unless Dr. Shafter, as of the FDA, could assure me that the Lewin report would not be published, I was instructed to make an appointment with the Commissioner Edwards, that's the Commissioner of FDA, and make our viewpoint known to him. And they threatened a lawsuit. When I pressed for an assurance that the report would not be issued, the FDA guy Schaffner said it would be issued only over his dead body. Of course, J&J had already been told in 1971 in a written report that Langer had found chrysotile in J&J talc. So this is the second test where asbestos was found in J&J talc before the FDA was pressured by J&J to withdraw the Lewin report. In the final report, the FDA changed Lewin's chrysotile results for all of J&J's samples, going from small percentages to non-detected. Sperry Rand confirmed Lewin results in a test he did for the FDA. J&J pressured him as well. This is the original final report, and this is the final report. So we went from 2 to 3% to ND, which is not detected. Only one specimen, which was medicated powder, was left with trace of tremolite. But that wasn't all. In September of 1972, J&J funded the University of Minnesota, who also found chrysotile in shower to shower. And they sent pictures. These are actual pictures of chrysotile that Minnesota had found. None of these results, not Lewin's, not McCrone's real results, not Hutchinson's, these are Hutchinson's results, not Hutchinson's, not Langer's, and not McCrone's real results were ever sent to the FDA by Johnson & Johnson. Instead, Johnson & Johnson lied about the product not having asbestos. Later on, 73, McCrone found chrysotile in other products. These results were never given to the FDA. Again, in 74, McCrone later gave J&J results finding chrysotile, not given to the FDA. This is a meeting describing Fuller's meeting with Sperry Rand, where the Sperry Rand researcher said the fibers were characteristic of chrysotile. But they got Sperry Rand to change their report too. He claimed that some of these, what he saw as fibers, could be other material, including a scroll of talc. And this is again FDA being told by the J&J and other companies, because at this meeting, the Cosmetic Association was represented, claiming that the Lewin data was incomplete because it relied on X-ray diffraction. But X-ray diffraction is not an insensitive method. It's an overly sensitive method, potentially, because it can also find non-fibrous particles. But by this time, J&J had known that the fibers found were real fibers and not non-fibrous rock. That's what Hutchinson showed them, that's what Langer showed them, and that's what McCrone told them. They also recognized that light microscopy used to confirm X-ray diffraction could miss fibers. The FDA said they're willing to live with missing some asbestos. Again, over my dead body, and the guy didn't die. He hid the report. Other Lewin confirmations. Johnson & Johnson found asbestos in the talc. McCrone did. FDA did later on. Hutchinson, the University of Minnesota, and Sperry Rand all found asbestos fibers in J&J talc. This is an FDA test done in September of 1973, a year after Lewin's results were changed. And they found fibers, unquestionable fibers, tremolite actinolite in Johnson & Johnson's talc, cosmetic talc product. Cans of shower to shower. Finally, in 1976, FDA met with Langer, who had done retesting of a variety of talcs where he'd found asbestos. Langer gave them results. Langer reported being disgusted by the talc industry's attitude. He said the results of his work had been known to the industry for several years, but nothing was done until the analytic results became public. His results were published in the New York Times that year. And that concludes this section of the industry history of hiding asbestos and talc.